Hello, my name is Dr. Kavyan Malani. This is Medical Updates. Today the topic is going to be the treatment and management and screening for osteoporosis. A major medical issue in the United States is osteoporosis. It is an illness that basically leads to fractures, and the hip fractures in general are the most lethal component of the subsequent issue in osteoporosis. The stage of osteoporosis basically are osteopenia that precedes osteoporosis, which is a weakening of the bone, and before that we have normal bone. Some bones, however, may be kind of structurally weak, but if we do radiographical studies on them, they may be actually normal. So the testing by a scan, a bone scan, in general is not always the best way to risk assess. The literature on the issue is actually pretty complicated, but it turns out that there are two separate approaches. Everyone agrees that for women at the age of 65 with a particular risk of fracture, osteoporosis screening should be done. The best way to do this is to actually do a bone densitometry, and then there is a gradation of scores. If the score is 2.5 and below, then the diagnosis of osteoporosis can be made and treatment should be initiated. Between 2.5 and 1.5, then the question really is, it's osteopenia, it's a weak bone, it's poor bone, but it is not basically bone that has osteoporosis in it. And so basically for that bone, there's basically a number of treatments can be initiated, some medical treatments, some vitamins, some exercise, some calcium, and that is the way to go. The complication really here is that there is a tendency to overtreat. So basically for osteopenia, which is a weaker form of bone and not osteoporosis yet, the treatment has become kind of standard, and so aggressive regimens of a monthly medication or a daily medication or a weekly medication is added on board, in addition to calcium and vitamin D, to try to basically get the bone loss to stop. The issue that I want to bring to the attention for this program is that sometimes the treatment just by medications is not really appropriate. And if you look at the best data for prevention of osteoporosis induced fractures or caused from falls in these patients, the key issue is this. If osteoporosis is present in the hip, and by looking at the hip and the trochanters, there's a risk of that, then the initiation of medication can be very beneficial, but only medications should be used that have documented benefit for prevention of hip fracture. And really at this time, basically this is very limited in terms of the exact treatment. There's only a very limited number of medications that have actually been studied. The number needed to treat for these medications is extremely high. Somewhere in the vicinity of 60 to 70 patients have to be treated for 3 years' time to prevent one case of a hip fracture. So the case of the hip fracture is kind of complicated because really even as a best scenario, best medication, the treatment basically is not always going to be beneficial, and many patients will still have osteoporosis and will have fractures. The treatment, in my opinion, consists of vitamin D, an adequate dose, but not the super high doses at all, because those doses actually do increase and have associated increased fall with them. Calcium has to be kind of supplemented at about 1,000 to 1,200 milligrams per day, and the most important element is basically walking and lifting and weight-bearing exercises to get the hip, the bone, and spine strengthened. I should say a word about the spine. A lot of people treat the spine. Remember that most of the data on the spine is from basically radiographical fractures that are not clinically important or are from fracture of the spine that are basically not, again, clinically relevant and do not cause a clinical issue for the patient, and so treatment of those agents is not really recommended in order to prevent spine issues, because what gets the osteoporotic patient, what gets the osteoporotic woman is actually not the spine fracture, but the hip fracture. So having said that, the only other thing that I think is important for us to keep in mind is that don't forget early advocacy of vitamin D and calcium and weight-bearing exercises. The most important thing right now would be to basically have the patient follow up with their physician, and in that setting, what we want to do is we want to proactively get the woman to be strengthened. In general, I do not recommend testing men unless they have a atypical fracture that's concerning and at the age of 70. Thanks for watching Virginia Medical Updates. Please feel free to contact us at 703-383-4836 or at virginiamedicalupdates@gmail.com. And don't forget to like and share our video on YouTube, Facebook, and Twitter.